Hello and welcome to Excellence for Quality Improvement E-QIP Project's quick quality improvement webinar series. Today we're going to talk about Plan, Do, Study, Act, the PDSA cycle, number 7. So I'm going to do a review of what E-QIP is, a model for improvement, and then we're going to take a detailed look at the PDSA cycle, including why small tests of change are important, what PDSA means, hints for measuring. I'm going to show you a worksheet which will be very helpful for you, PDSA ramps, and then give an example which will help make this more clear. So as you may recall, E-QIP is a partnership initiative between Addictions and Mental Health Ontario, the Canadian Mental Health Association for Ontario, and Health Quality Ontario, and its purpose is to support and promote quality improvement in the community mental health and addiction sector. It really is about supporting the excellent work that the sector does already and its commitment to providing high-quality person-centered care to individuals and families. So quality improvement is a systematic approach to making changes that ultimately lead to better outcomes for clients, and that's improved health, stronger system performance, which is care, and enhanced professional development. It invites all of us to be involved in identifying problems that can be improved and then also to do quality improvement activities. So healthcare professionals, clients and their families, researchers, planners, and educators. This is a nice diagram of where quality culture fits into all of the different components, which I'm hoping many of you will be aware of. So the domains of quality are equitable, safe, effective, client-centered, integrated, and timely access to services. The model for improvement helps us to work towards meeting each of those quality domains. And our quadruple aim ultimately is for better health for the population, better care for the individual, lower costs ultimately, and that it's a satisfying experience both for the provider, but also ultimately for the person that we're serving. This is a model for improvement, and we are actually going to be looking at the PDSA piece, which is testing and implementing change. So we will be looking at that in more detail. So up to this point, we've identified the problem, we've identified the aim statement, we've identified the changes that we're going to try to make, and now we're going to test out those changes. It doesn't fit quite as nicely into the project charter at this point in time, but it really comes under, in part, the barriers and mitigating strategies when you're thinking about your PDSAs and the cycle that you're going to go through. So PDSA cycles, what changes can we make and what results that will result in some improvements? It is about the changes that we're going to try and using a systematic approach, a plan, do, study, act approach to figuring out whether or not this new change idea is the right one for us to permanently implement. So we start with small tests of change, and we want to build on those. So we're doing a small change with a few people, with a few staff members, different types of patient complexities, different shifts, different days, to figure out, does this hold true? Does this change really make a difference? We start small so that we know whether or not we're actually making some changes. And by doing a small sample, we know that we get a chance to decrease the likelihood that people will be resistant about the change, but also that we'll get it right beginning, or we'll know what tweaks we need to make this change better. So in the past, and probably more typically, people have sort of come up with an idea. They've maybe talked with a couple of people on their team, often senior leaders, implemented the change, and then wondered why it didn't occur. And they haven't really looked at, were people engaged in the process? Did we get the results we were expecting? Did we plan for the results that we were hoping to get? And do we know whether or not this is the right thing to do? So the PDSA cycle helps us to do that. We begin with a plan. What will happen if we try something differently? And these emerge from our change ideas. So we're going to test out some of those change ideas. We're going to figure out what we want to learn. We're going to make a hypothesis and guess what we think might happen. And then we're going to figure out what we need to do, when and where, small sample, and then we're going to collect information about what it is and what information we want to collect to know whether or not our change actually made a difference. The next step is actually do it. Let's try it. Let's carry out what it is we want to do, and we're going to think about what problems we encounter when we tried to do that, and were there any surprises that we weren't anticipating, and we're going to write this stuff down. We're going to keep a record of it. Because when we start doing those tweaks, sometimes we forget what we've already tried. Then we're going to study it. Did it actually work? Can we compare our data? Was it what we expected? Are we getting the outcomes that we're hoping to learn? And then think about what it is we actually learned in the process of doing. And the last stage is act. So what's next? Do we adopt this? Is it the right thing to do? Do we abandon it because it was a complete failure? Or do we tweak it a little bit? Do we adapt it a little bit based on what we learned? Try something slightly different, make a small modification. And I'll give you an actual example, which helps to make this more clear. When we're thinking about a PDSA, we need to think about whether or not we believe there's going to be a success, and what happens if we fail. And ultimately, we want to figure out whether we do a small scale or a one-time scale. It really depends on whether we think this is going to work and what are the consequences if we fail. So if we think about something that we really believe is going to work, so a high belief it's going to work, and it's a minor consequence if it fails, we may be able to just do one cycle to figure out if this is going to work. But if it's a low belief that it's going to work, and if it really doesn't work, it's a catastrophe, we want to do a very small scale test to see if there's any relevance for this kind of change in our environment. So a great 4x4 or 2x2 to help you figure out what it is you should be, how you might implement your change. This is a PDSA worksheet, a very useful tool. It helps to keep a record of what it is you've tried in terms of your PDSA. There's a section for plan, predictions of what might occur and the questions we might have, the data that we want to collect when we actually do it, what we actually found out, study, and you can write down your results there. And then do we need to go on to try this again in a slightly different format? When we're thinking about the PDSA, we think about that sort of developmental stage where we're really just testing with our colleagues. There's no client involved in this stage. It's a new form, it's a new way of doing things. We want to test with our clients, or sorry, our colleagues, whether this might make a difference. When we're testing, we're actually doing a small number of clients to begin with, and then we grow those into larger tests, and we see whether or not that works for the client. And then when we get to implement, this is where we're pretty sure we've got it, and we have to think about how we're going to hardwire this, how we make sure that this change continues. And then most importantly, the spread, so that others know what we've learned and they can benefit from our experiences. So the example, and some of you may be familiar with the Live Well Recovery Service. It's an agency in a small Ontario, or mid-sized Ontario town, about 100,000 people. There's 3 sites over the town. Some is in the city center. There's a suburban and a rural community, a variety of complexities of the client. They've had a long-standing problem with access to their intensive case management program. So ultimately, it's taking 108 days from the point of referral to service initiation. They've been tracking this through a management software, and they record the date of referral as when they receive a referral either from primary care, a community partner, or perhaps a family member or a client when they first make contact with the service requesting a individual to have an assessment done. So here's an example of how we might write this down, or how might we record our PDSA cycle. So the project is the Live Well Recovery Service Case Management Wait Time QI project. This is our 3rd cycle. So we've tried 2 things already. We're looking at the dedicated time each week for intakes for new referrals. And we're going to test this over a 2-week period from July 1st to the 15th, 2008. And this is actually a test, which means we're going to be doing it with a small group of clients. So when we plan this out, what we're going to do is have the morning receptionist at the service will dedicate 1 hour a week on Friday mornings to process the referral. So that's data entry of the referral form, booking the assessment, conducting the intake, and they're going to do that for 2 weeks beginning in July. So the next stage is the data collection. So will we have more assessments booked, lower the wait time and the referral to service initiation, and there won't be any buildup of referrals if we try this change. So what we found when we collected our data is the number of incoming referrals. Actually, we tallied that on a sheet. The data is important to collect because it will allow us to understand whether the 1 hour, the 1 staff is enough time. So this is what our prediction is. And now we're going to actually do it. So when we did it, what happened is the morning reception was able to process 3 of 5 incoming referrals to the intensive case management program during that time period, and it was the Friday mornings. What she found is it was really busy on Friday mornings, and they only worked till 1 o'clock that day. And as it turned out, 4 of 5 referrals came from family physicians on the Friday afternoon. So those were not even looked at. So when we study that, when we think about what we actually learned from that PDSA cycle, the morning receptionist noticed that Wednesday mornings on both weeks that she was working on this were actually lighter in terms of the workload. And there was admin staff present late on Tuesdays, and so there was very little to catch up from the night before. So now they're thinking maybe Wednesday morning might be a better option to do this work. So they go ahead, and on Wednesday morning, she spends an hour each Wednesday processing the referrals. So when we're thinking about using the PDSA cycle, there's a couple of things that are really important. So one is oneness, one patient, one provider, one day. Small, start small. The next thing that's really important is think drop 2. So if we want to test for a week, then we need to do this hourly. We need to be recording our data hourly so that we know whether or not we're seeing any change in terms of our change idea. And then we test it under a number of conditions. So are there other patients that this might work differently with? Are there other providers this might work differently? Is a different day or a different time of the day, are we going to get different results? So we think about our cycle in terms of the size, the time, and the conditions that we need in order to try out our change idea. And the more inclusive we can be, the better information we have. Some people confuse project versus PDSA measures, and I just wanted to spend just a second talking a little bit more about that. So project level measures are sort of evaluated over the whole quality improvement project. So if we're looking at the wait times with the Live Well program, we would be recording those wait times all the way through that project. When we're looking at the PDSA, we're concentrating on a period of time where we're testing our idea. So it's the impact of that change being tested, and we're looking at a much smaller scale of time. And we often think of those as temporary measures because we may or may not choose to keep doing that. So here's one of my favorite confusing pages, but it really puts the model of improvement and PDSAs, we're looking at that last box, which is change ideas. What changes can we make that will result in improvements? We begin with our change concept. We do a very small scale test. We do some follow-up tests as we're moving along that data line towards changes that result in improvement. So we test it, we tweak it, maybe it's better. And in the example, we were actually on our 3rd PDSA cycle. So that's that 3rd circle as you're working up the ladder. And then we tried in a little wider scale. And if we find that this is really working, then we want to think about how we make that a part of our everyday practice. So this is, so thank you for joining today. This is some information about our E-QIP team. Should you have any questions, should you have further questions, if there's things you think that we could do to improve this webinar, then please don't hesitate to contact us, any of these numbers. And if you're not on our mailing list, please think about doing that. Thanks so much for joining. I'll see you in the next webinar.